Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we'll all enjoy it. Thank you. Welcome to another facilitation session on essential drugs, PHS 426 for this week. In the previous week, that's the last week, we discussed national drug policy and its concepts, the goal and objectives, and we also looked at the national drug formulary and what we call the primary strategies for implementing national drug policy. So this week on topic 2, we'll be looking at management of essential drugs and the supply system. At the end of this lesson, we should be able to define what essential drug management is. We should understand the elements and essential drug selection criteria, methods of selection, quantification, and costing of drugs, as well as understand the procurement and distribution mechanisms of essential drugs. So we'll start with what can we define essential drug management as? Essential drugs, every definition of essential drugs is based on what it means. So when you define the essential drug management, you also look at the concepts and the components of essential drugs. What makes a drug essential drug? So essential drug management is the efficient use of drugs that are safe, effective, and affordable, and must satisfy the healthcare needs of the population. And by satisfying the healthcare needs of the population, we mean they must cover the prevalent diseases and conditions in such population. So this brings us to the elements of essential drug management. We've defined what essential drug management is. Now, what are the elements? The elements in managing essential drugs, how do you manage it? What are those components of the management? First, you have to select the drug. Secondly, after selecting, you quantify your drugs. You look at the quality and quantity of the drugs you need, then you cost them. Before you order such drugs, ordering must be in the required quantities that you have actually listed and the ordering interval required. Then you receive and store your drugs before we now look at what we call in the processes of all these, from selection, to receiving and storage. How is such drug distributed from points of collection to the point of delivery? You look at also what we call inventory control, prescribing, dispensing, and use of such medicines. So what are the criteria for essential drug selection? What do you look at when you're selecting drugs, essential drugs? When you're selecting essential drugs, you must check the safety of such drugs, the efficacy of such drugs. In other words, the drug must do what it's intended to do, the purpose at which you are using the drug, that is the efficacy. You look at the cost implication of such drug, and then if it is locally manufactured. You also consider the health needs of the people. Of course, you won't be getting drugs that the people don't need. And such drug must be available at all times in adequate amount and dosage form. Such drug must be accepted by people in terms of it has reduced side effect, and the drug must be selected in its generic form and not trade name. It has to be the generic name, the chemical name of the drug. Such drug must be administered easily and then you must have the adequate personnel for such selection. Now, when you are selecting drug, there are methods you must consider or you must use in selecting your drugs. These methods are centered on cost reduction. Of course, when you're selecting drugs, you must make sure that your drug is cost effective. And there are two major methods in such cost reduction, drug method selection. One is the ABC value analysis, and the second one is the Venn system. The ABC value analysis focuses on the A, the B, and C. A simply means the high cost of such drug, medium cost, C is the low cost. You categorize these drugs according to high cost, low cost, and medium cost. Such drugs must be of therapeutic value, and the costing system must be cost effective. So you look at the therapeutic value and the cost of such drugs when you are using the ABC value analysis. Now, in such method of selection, the ABC method, you might find out that the high cost, the drugs that are at high cost, might be constituting majority of the cost items, and they might be few in number. However, the Venn system looks at also the potential health impact of such drug. Of course, every drug must have potential health impact. Drugs are usually placed as either it is a vital drug, is essential drug, or non-essential drug. So you look at these components when you are doing, you are involved in drug selection. After you have selected your drug, the next thing to do is to quantify your drugs. Quantification is basically determining the quality of drug for a certified health problem. It's not just the quality, you also look at the quantity of such drug. That helps when you list them, and then you now look at the quality, and then you now also look at the quantity of such drugs that you need. When we quantify drugs, there are some methods that we use for quantifying drugs. You can use what we call the morbidity method, the consumption method, and the epidemiologic method. In the morbidity method, you look at data on illnesses that are prevalent in such community, and how often such illnesses consume medication as relative to the other health conditions. Then you look at general consumption method, the total consumption outlook of medications for various illnesses that prevalent in that community, and other health related conditions. Then another aspect of quantification method is the epidemiologic method. In this case, you look at the disease pattern and the care-seeking behavior of the people. You study that epidemiologic pattern of diseases in that locality in terms of age, sex, and all that, and that will help you to quantify your medications. So quantification methods are or is involved when you use morbidity, consumption, and epidemiologic methods. So after quantifying your medications, you now go into costing and procurement. Now, in costing your drug, you still use the same method for selection, the ABC value analysis and the Venn system, which I had explained. The ABC system, you look at the high cost of medications, the middle cost, and the low cost. And then in the Venn system, you categorize the medications into vital, essential, and non-essential medications, and then you decide on which one to use. So when you're procuring, what are the components of procurement? What do you look at? You must make sure you have trained personnel for such procurement. You must have a well-designed procurement system, and you must have a functional information system in terms of stock, stock taking, stock information, and drug dispensing and all that. You must have a suitable organizational structure, and you must have adequate funds, of course, for you to procure, and you must have facilities for storage and equipment. So what are the steps you consider in procurement? When you want to procure, you must look at how often you need to order medications. You must also list the drugs that you need. Then you complete the requisition forms, the forms you need to make such requisition. You complete it, listing the drugs that you need and the amount and all that, the quantity. Then you calculate the cost of such drugs that you want to order. Then you forward money for drugs ordered together with the requisition materials. These are the steps you take in procurement. Now, before purchasing essential drugs, there are several processes that you need to take, what we call the purchasing methods that you need to take before you purchase medications in terms of advertising and all that. Now, the first one is open tenders. Open tenders is a bidding process. It's open to the public and usually advertised. Companies that need to supply the medications and that have track records will apply for such bidding process, and the best is selected based on antecedents. Now we have closed tenders. In closed tenders is not like an open bidding process like open tenders. This one is a restricted kind of bidding process and is usually for existing suppliers, and people are chosen, or suppliers are chosen based on satisfaction of predetermined criteria, in the sense that they may have been supplying you medications, they may have actually met the timeline in terms of the actual date they need to supply, the quantity they needed to supply. So they've had a good relationship with your company, or with the organization. So in such cases, it's closed tenders. Then there's negotiated procurement. Here, the buyer buys directly by approaching the supplier and negotiates prices and conditions before such drugs are supplied. You could meet the pharmaceutical company or a wholesaler of such medications and negotiate directly. Then there is also the direct purchase method, which is cash and carry. You pay and then you get your medications. Then some medications are also supplied based on donations, like philanthropies in different countries, NGOs, bilateral organizations, and some nations, as a form of humanitarian aid, could supply medications to other countries in need, like in cases of disaster and natural causes and all that. So what are the things to consider in drug storage? When you have procured your medications and it's been supplied, what are the things you need to consider when you're storing such medication? When you store medications, you must be sure of the temperature that the drug requires. Some drugs need to be refrigerated, some need to be kept in room temperature. So you must make sure that such drugs are stored appropriately at the required temperature. You look at the humidity. Some areas might be damp, with not good humidity, and that might affect, efficacy of such drugs. Then pilfering from burglars, you must make sure that that place is properly protected from thieves and burglars. And then pest control, you must make sure that such a place is protected from invasion of pests. Then the stock control in part of your drug storage system is keeping inventory. You must have stock cards, what we call stock cards, and stock control books for stock taking. When you are done with storage, now there is something else we want to look at, which is the distribution of drugs. Drug supply from the point of acquisition to the point of need such drugs must be safe, secure, and distributed in an expeditious manner to the health facility, where it must be properly stored and dispensed to the consumers. We've learned how to define essential drugs management, which is focused on the concept of essential drugs. We also understood the elements in essential drug selection criteria. We also looked at the methods of selection, the quantification of drugs, costing of drugs, as well as how to procure and distribute essential drugs. In our next lecture, we will look at the pharmacology of essential drugs in primary health care setting. Thank you for listening.